Hello, my name is Olivia Lindly and I'm an assistant professor at Northern Arizona University. I'm thrilled to have the opportunity to briefly present about our research, Parents Taking Action to Improve Autism Services Access for Diné or Navajo Families, preliminary qualitative findings. I'd like to start by first acknowledging our project's collaborators, Candy Running Bear, Dr. Davis Henderson, and also our advisory group members, which include 3 Diné mothers of autistic children. And I'd also like to acknowledge the generous support we've received to conduct this work from the Southwest Health Equity Research Collaborative. A little bit about the impetus for this project. We know that autism is a chronic and complex neurodevelopmental condition that affects many children and their families. We also know that timely diagnosis and treatment or access to services like behavioral therapy can really help to optimize health outcomes for autistic children and their families. However, it's been established that persistent disparities exist in accessing services for autistic children of color, including those who identify as Indigenous. Here in Northern Arizona, about 29% of individuals identify as being Indigenous, and the largest tribe in this area and the nation is the Diné or the Navajo tribe. However, we don't know much at this point about Diné families' experiences raising autistic children, and we really do need more information in this area so that we can inform parent education and training programs for this population. And so our initial aim for this work was to provide greater understanding of Diné parent and guardian experiences raising autistic children, and then we're using this information to inform a cultural adaptation of the Parents Taking Action program, which is an evidence-based parent education and training program delivered by community health workers. And then we're also going to be piloting this program with 10 to 15 Diné families of children who have or are at risk for autism. And so in terms of this initial aim, we have been conducting outreach across the Navajo Nation, and we have received approvals from all of the Navajo Nation agency councils as well as the Navajo Nation Human Research Review Board to conduct this project. And through that outreach, as well as referrals from our community advisory group, we have recruited and interviewed 12 Diné mothers of autistic children. And from our initial analysis of the interview data, we have found 3 preliminary themes. The first is that greater understanding of autism is needed among Diné families. The second is that pediatrician screening and referral facilitates early autism diagnosis for Diné families, and there are several initiatives related to that underway right now on Navajo Nation. And the third theme is that schools often provide the most autism services to Diné children, but parent and guardian autism education and training is limited. And so again, we're using this information to help inform our cultural adaptation of the Parents Taking Action program to help increase autism knowledge and also parent training. And we will be piloting that adaptation come summer. So thank you again for listening. And again, thank you to all of our collaborators and partners and funders for supporting this work.